Hi, I'm Kristy, Director of Marketing and Communications here at Interim HealthCare, and today we're going to talk about hospice. And we know that hospice can feel like a scary word, but really it's about dignity, comfort, and support for patients and their families. And we also know there are a lot of misconceptions around hospice, and sometimes families and patients don't know what to ask or are afraid to ask. And so that's what we're going to talk about today. And so I have Amy Wilson here with me. She is a hospice liaison here at Interim HealthCare, and she walks families through this every day, having the conversation about hospice and how it can make a difference in their life.
Thank you, Kristy. I'm so excited to be here. I know just personally firsthand how these decisions can be hard and can be scary and overwhelming, and just want to get rid of some of those misconceptions that hospice truly can be a blessing and joy if it's presented to the family properly.
Let's start with the big misconception. This one comes up a lot, is that hospice feels like they're giving up. Is that true?
So no, that's not true. Hospice, when you come to hospice and it's time to talk about hospice, a lot of families feel, oh gosh, this is the end of the road. I'm giving up, all of these emotions. So hospice is not giving up. It's actually about life. It's about quality of life. But I will say that in those situations when families do feel like giving up, we can come in and give you the best support so that you feel like there's hope and joy and love and all of that. And so what we want to do is come in and make it feel like there's life again, even in those hard times.
Yeah, it feels like it's the right care at the right time.
Yes.
Right?
Yes.
So I know some people feel like hospice is really just for those final days, but tell me about, like, how long can someone be on hospice care?
That's a great question. So hospice actually comes when there's a terminal illness, and it's usually 6 months or less. I personally do not like to put a timeline on someone's life, and it's more about that day and present time when they've been given the diagnosis and there's no other treatment available. So patients can come on, and sometimes when patients come on sooner and not later, they actually can live a little longer because their quality of life, they're getting more attention. The patient's caregivers are getting support too. So it's 6 months or less, but we like to look at what the present day is and evaluate that, and it's day by day, right? So what we want to do is just get in the home and make the patient comfortable in mind, body, spirit, and family. That's what's important for us. And so we stay in the present day of what that 6 months looks like at that present time.
Okay, so another big topic that's kind of a misconception around hospice is medication. So what would you say about families coming on or thinking about hospice care who are taking medications?
So we ultimately, when a patient comes on service, we review the medications, and we don't necessarily stop or change things right away. What we want to do is focus on the patient's concerns, the caregiver concerns, and see if there's ways that we can alter those medications or take away and add to give that patient the full benefit. So if it's pain medication or agitation or just all of those things that we would think of for comfort instead of curative. So we would focus on those type things. We have an in-house physician for hospice who would review all of that, and it's actually a team that would come together to encompass all of that to make sure we're meeting the needs for the patient.
Okay, Amy, so what about people who choose hospice and then decide they want to stop?
Yeah, so that actually happens oftentimes either in the beginning or sometimes when a patient is on hospice, they may get a little better, and they're not better, maybe not cured, but they don't qualify for hospice, meaning they haven't had a decline. So hospice is patient choice. And so it's an election that you elect for the day that you're in. And so it may be getting home, getting more comfort, that you decide you want to see if there's treatment out there. That is okay. Everything is flexible. But I often think if we just stay in that moment, in that day when the doctor has said hospice is necessary, or a physician has deemed there's no more treatment, I think it's just a great option to know that you can have hope even though you've elected hospice.
Okay, so Amy, we know that hospice isn't just for the patient, it's also for their family. And so talk to me about how Interim HealthCare comes along and supports the family.
So this is probably my favorite question. I do believe it's the most important question because the answer is so awesome. So we come in and we provide families with an array of services that encompass the care team. And we come in and it's the mind, body, and spirit and families. And we take that value and just we have a nurse that comes in, we have a social worker, we have an aide that comes in, and a chaplain. And so all of those things that we can offer the patient, we basically are holding God's hand and walking you through this hard time. Sometimes it's tragedy, sometimes it's they've just learned for the last week that the patient needs hospice. And so what we try and do is just bring some comfort to everyone in all of those avenues. And so hospice I tend to think about as the old school medicine practice where it comes into your home, it's at your convenience, and it just gives that extra feel that it's personal care in your own place, but also it can be just a blessing in a hard time.
What a gift to the family.
Yes, yes.
Talk to me about what does it look like when people ask the question about the cost of hospice?
Yeah, so the cost of hospice is a question that gets asked pretty frequently. Medicare, Medicaid, and most insurance companies have a benefit to hospice and have 100% coverage on down to a certain amount depending on private insurances. And some supplies are covered with the election of hospice. So it would not be an out-of-pocket expense to come on services with hospice.
To kind of wrap up these questions that come up around hospice, talk to me about the bereavement services that we offer.
Yeah, so bereavement and grief support is offered to our patients. So when a patient comes on service and the patient passes, we're still involved. So we offer bereavement and grief support for a year or so after. So you still become connected with that family and help them just get through the transition and the little hole that may be in their hearts, that we can just provide some love and peace and joy to them. And one thing that we know when we talk about hospice and dying and those things, that one thing I love about hospice is that we can provide joy even in sadness. And I think sometimes that when we stay connected with families, it gives them that little bit of hope that they gave the best direction for their patient. And so we stick around for a little bit in hopes that we can just help them transition over that period of time.
Great. Thank you for being with us today and just talking to us about hospice care and answering some of those questions that people may have and either were afraid to ask or didn't know to ask.
Yes, well, thanks for having me.